Hello everyone, in today's video we are going to discuss about how to measure nuchal translucency. So what is nuchal translucency? Nuchal translucency is actually our normal fluid filled subcutaneous space. So it is actually a fluid filled space on the subcutaneous plane. So it lies on the back of the fetal neck. So it is measured between 11 week 3 days to 13 week 6 days. So why we actually measure nuchal translucency? Because thickening of the nuchal translucency is associated with aneuploidy. So normally, nuchal translucency is considered normal if it is less than 2 millimeter. So if it is more than 2 millimeter, then we have to suspect aneuploidy. So here is a diagram showing fetus in the mid-sagittal plane. Nuchal translucency is actually a fluid-filled space in the back of the neck. Here is the fetal neck and it lies on the back region. It lies on the subcutaneous plane. So here is the fetal skin. So it lies on the inner part of this fetal skin. So it lies on the subcutaneous plane on the back of the fetal neck, and it is actually a fluid-filled space. So how we actually measure the nuchal translucency? So this is the ideal position of the fetus to measure nuchal translucency. For measuring nuchal translucency, ideal positioning is quite important because a small change in the nuchal translucency thickness can have serious impact on the patient management. So ideally we measure nuchal translucency in mid-sagittal plane. So vertebral column should face the bottom of the screen. Here we can see the bottom of the column of the fetus is facing the bottom of the screen. Ideally, we should be able to see these four structures. So tip of the nose, nasal bone, hard palate, and the diencephalon. So here in this diagram, we can see this is the tip of the fetal nose. This hyperechoic structure is the nasal bone. This hyperechoic structure is hard palate, and this is the diencephalon. Here in this diagram, we can see this is the nuchal translucency. So head should not be extended or flexed. So head should be in the neutral position. So for that, we have to see the space between fetal chin and the fetal chest. So if there is a small amount of the amniotic fluid in between fetal chin and the fetal chest, then we can say this is a neutral position. So fetus should be floating free of the uterine wall, that is amniotic fluid should be seen between its back and the uterus. So here in this diagram we can see there is a small amount of the amniotic fluid between fetal back and the uterine wall. This is the ideal positioning of the fetus for measuring nuchal translucency. So in this diagram, this is the nasal bone, this is the hard palate, this is thalamus, and this is the nuchal translucency. Only the lucency is measured. The calipers are placed inside the hyperechoic edges. So here in this diagram, we can see there are two hyperechoic edges, and we place the caliper on the inner side of these two hyperechoic edges. So this is the ideal positioning of the calipers. So this is the wrong way of measurement. This is also the wrong way of measurement. We actually keep the midpoint of these calipers on this border. We should not include this hyperechoic line, and we should not include this hyperechoic line. We just measure this black area. So widest part of the translucency should be measured. We should not measure the nuchal translucency in this part. We should not measure in this part. We should measure the widest part of this translucency. This is the ideal way of measuring nuchal translucency. So interpretation, the rate of the aneuploidy is directly proportional to value of the nuchal translucency. Less than 2 mm have a risk of less than 1%. So if the nuchal translucency is more than or equal to 8.5 millimeter, then risk of the aneuploidy will be 75%. So to increase the clinical accuracy, it can be correlated with serum markers. So nuchal translucency can be adequately assessed if there is unfavored fetal light, or if the crown rump length is less than 45 or more than 84 millimeters. In that, if the crown rump length is less than 45, then it will be less than 11 weeks, and if it is more than 84, it will be more than 13 weeks, 6 days.